One more disclaimer before we get started, and this is our usual disclaimer that we have. The alignment with the ASAM criteria is a requirement for drug and alcohol treatment providers who receive funding from the SCAs, the single count authorities, or the managed care organizations. We really want to stress the importance of reviewing the ASAM criteria in the text, as well as attending trainings and reviewing any resource documents that we have posted on our website. So please understand that the information that we present are really to guide you and give you a further understanding of targeted topics or specific topics in order to help you understand ASAM and understand how those topics kind of fit into the full ASAM criteria in its entirety. So we can't stress enough how important it is to read the text and attend the trainings and use the resources that we have on the DDAP website. So with that in mind, we'll go ahead and we will get started today. So our learning objectives that we have for today around the alignment reviews. So we're going to review the purpose of the alignment reviews. We're going to go through the process that we developed in order to implement those alignment reviews. And then we also have some additional presenters today who are going to talk about the strengths that were observed during those reviews and also some of the areas and improvements that were identified during our alignment process. And then lastly, we'll talk about the next steps as we look to move forward to a larger scale kind of dissemination of looking at ASAM and how ASAM is being implemented in Pennsylvania. So today we have a series of presenters who have been part of our larger scale alignment reviews. So you have me, Erica, from the Department of Drug and Alcohol Programs, who participated in the reviews. We have Benny Varghese, who's the Department of Human Services, who's going to talk to us briefly today about giving us some more background on the 11 and 15 waiver. We have Jesse Mayfield from Beacon Health Options. We have Rebecca Knoll from Perform Care. We have Raina Busix from Community Care Behavioral Health, and we have Anita Kelly from Magellan Healthcare of Pennsylvania. So what we are going to look to do is to first talk about the purpose of the ASAM alignment reviews with Benny from DHS. He'll be discussing specifically, giving you a little bit of a quick background on what that looks like. And Benny, I will now kick that over to you.
Thank you, Erica. My name is Benny Verghese. I'm the Division Director for Program Management and Planning with DHS's Office of Mental Health and Substance Abuse Services. So, as you saw in one of the previous slides, before we get into the discussions about the process involved in the alignment reviews, and before we share some of the observations that we had from the reviews, before we do that, we wanted to make sure that folks on this call know why we are doing this alignment reviews. Uh, Actually, there are a couple of reasons why we are doing it, and some of you may already know the reasons. Uh, as many of you on this call might know, since July of 2018, Pennsylvania has had an 1115 waiver, which is also called a demonstration, which allows us to receive federal Medicaid dollars to provide services in SUD residential settings. This was approved by CMS first time effective July of 2018, and this was reauthorized or renewed just last month. So the current waiver is good till the end of September of 2027. So we have 5 more months of, 5 more years of this waiver that is valid now, and we do intend to, have this extended even beyond that. So it was this waiver, as I said, that allows us to draw down this federal dollars. And if we did not have this waiver, you know, Pennsylvania, it would be really challenging for us to continue to provide some of the services that are currently provided in SUD residential settings. Uh, this waiver also comes with a lot of requirements. And one of the requirements, as you can see on the screen, is that we should be, or we must be using ASAM criteria. So along with that comes the stipulation that the Commonwealth has a state process in place to ensure that the providers of substance use disorders are providing care consistent with the ASAM criteria. So that's one of the primary reasons why we are doing this ASAM alignment reviews. The second reason is a state statute. You must have heard of Act 70 of 2021. Um, this act requires that all drug and alcohol providers in the Commonwealth, they have to align their service delivery with the requirements consistent with the ASAM criteria, third edition 2013. So that kind of summarizes the background of why we're doing it, the purpose of the alignment reviews. So now that we know what the purpose is, I think we can move on to the next slide, which I believe is talking about the process involved. So Erica, I'm throwing it back to you.
Thank you very much, Benny. Um, as Benny stated, we have to use an evidence-based tool in order to implement the requirements that are outlined in our waiver for the Center for Medicare and Medicaid Services. So the Department of Human Services and Drug and Alcohol collaborated with the behavioral health MCOs and SCAs to develop a process for reviewing residential providers' alignment with ASAM, the 2013. So in doing that alignment review, um, the DHS contractor that we worked with developed an ASAM alignment review tool for use during the pilot program. And that was done in conjunction with DDAP and DHS to work on a tool that would provide very specific items that outlined what we would be looking for as providers are doing their work with aligning with ASAM 2013. So, um, because this was a very large undertaking to kind of build out a process of what that would look like, the departments, we really brought in, our key folks who we work with, the behavioral health MCOs and the SCAs, and helping to monitor and carry out that alignment process. So it was, a fairly large scale task to undertake, and in order to build out what that monitoring process, we really had to start with what areas do we think is currently kind of in place that we might be able to build out and build upon. So what our review consisted of is it was an infrastructure review of documentations that would support ASAM alignment. So essentially, that's saying a policy and procedure or a documentation review. So we're really looking at an infrastructure review that would consisted of what documents are currently in place that will allow us to do a quick review to see how ASAM is really established at the provider, to give us kind of a general background and understanding. So the infrastructure review was completed offsite. So that was something that was more along the lines of a desk review. That was completed while most of the record reviews, the actual review of the medical records, that was done on site. So um, the ASAM alignment policy and procedure review, keeping in mind and understanding that we're really just kind of focusing on a documentation of what was had in place. And then the actual clinical record review, we were really looking to see how those policies, procedures, or documentation that you had was actually carried out. Who was involved in those pilot reviews? So again, as I iterated before, DDAP was involved, Human Services was involved. We have our behavioral health MCOs that were involved, Perform Care, Community Care, Behavioral Health, Community Behavioral Health, Magellan Healthcare of PA, and Beacon Health Options. We also had SCAs who were involved in assisting us with developing this process for reviews. We had Lehigh, Philadelphia, Dolphin, Beaver, Blair, and Lycoming Clinton were all instrumental in helping us take a look at our providers and to help get this alignment process kicked off. So at this time, we're really going to invite some of our other folks who were involved with helping to do those reviews. Our first presenter that we have is going to be Raina Busak, who will go over some of the strengths that we saw during the infrastructure review. And then we'll have some additional presenters who will take a look at some other items that we have for review. So right now, I will kick it over to Raina, and she can talk about some of the strengths for the infrastructure review.
Thank you, Erica. We did want to just at least first acknowledge just the ease of the electronic health records that we were able to utilize during our reviews for the ASAM and just completing everything. With the infrastructure piece of it, as Erica mentioned, that consisted of reviews of policies, procedures, schedules, maybe client and staff handbooks, job descriptions, training, and other supplemental documents that providers may have provided prior to our on-site reviews. Additionally, the providers also may have provided clarification to various questions that the teams had after initially reviewing those documents. And most of them provided either a written response or when we were on site, provided additional clarification. And during those infrastructure reviews, some of the highlights or strengths that we've seen were medication administration process was very clear and organized within the policies, and that included, from the beginning of when a written order was given through the dispensing of the medications to those in treatment. So we've seen many policies that were very detailed with that process. Additionally, for those providers that we were able to go on site, one of the things that we noted was that campus layouts really offered that ability for those multiple types of groups that they were indicating through their policies that they were offering, whether if that was for substance use, mental health, the psychoeducation and daily living skills, and really kind of outlined those different activities that providers were providing through their documentation, and then we were able to see that on site as well. We did see clear documentation clearly showing that staff of all levels were being trained in ASAM. And then additionally, there was documentation within the policies and everything about all the documentation being outlined to be completed within regulatory timeframes and kind of meeting all the different components of ASAM. If we could have the next slide, Erica. Thank you. Across providers, we did see thorough policies on the utilization review process that did incorporate the use of ASAM criteria to guide the most appropriate service and level of care that an individual may need. Also, during the infrastructure review, we did see a range of evidence-based practices such as modalities, CBT, DBT, motivational interviewing. We've seen a lot of evidence-based screenings also being listed out through the infrastructure review, the CALS, the DAST. We did see providers offering a variety of daily living programming. We seen some life skills tracks, parenting classes, resume writing, interviewing, nutrition classes, just to name a few. So we did see throughout the documentation that was submitted prior, a lot of evidence-based practices and things that were happening and being offered to individuals in treatment. Additionally, it was evident during our review that providers did have contracts or affiliations with local hospitals in their areas to meet maybe the medical and psychiatric needs of the patients in addition to the care that's provided on site. So there were really outlined processes with utilizing those services and having agreements in place. And then one of the other strengths that we noted from the infrastructure reviews across the board was 24-hour nursing really being available on site. And then also the physicians and extenders being available, during the typical Monday through Friday workday, and then being on call 24/7. And we've seen a lot of with the schedules and that being implemented as well. So those were just some of the strengths that we did note during the infrastructure review for all the providers.
Okay, thank you, Raina, for that information. There was definitely no lack of policies. There was a healthy bunch of policies that were submitted for review. Very nice to be able to work with the providers on reviewing those policies, procedures, and documentation. Next, we have Jesse Mayfield, who will review some of the strengths that were identified during the other main part of the review, which is the actual record review. Jesse.
All right. Good morning, everyone. I'm actually going to apologize for not going on camera. There's a huge delay on my camera this morning. I don't know if it's because there's so many people on the call, but unfortunately, you guys won't be able to see me. Okay, so I am talking about the record reviews, and throughout the pilots, we noticed that the initial assessments were very well done. They were very strengths-based, and they definitely were used to formulate master treatment plans. So definitely that was something that had a lot of detail and really well crosswalked to the treatment plans. All of the records throughout the chart documented stage of change, and even a lot of the records included stage of change on their group notes, individual notes, whatever progress notes. So that was really good to see, and it was a nice way for the providers, I think, to capture the progress that the clients were making through their treatment stay. We also thought that nursing assessments and notes were well documented. It was something that was really well detailed. They were timely. They were just very thorough and had good follow-up. The initial assessments, again, they were very thorough. As I said previously, it was really nice to see that each dimension was clearly defined, which I think was one of the reasons why it was able to crosswalk really well to the treatment plans. And then again, the documentation between the nursing notes, all of the clinical notes really justified the need for the members to be admitted to 3.5 level of care to continue their treatment. Next slide, Erica, please. Okay. So So the records, again, in the medical section really reflected well the medical needs that the individuals had. They were addressed appropriately. Consults were completed when necessary, and that was very timely. I think that was due to having, a complement of staff on site, as well as those partnerships that were mentioned earlier as well. Medication organization and documentation, again, was really, really clear and organized. That was really good to see. All of the providers did offer forms of medication for opioid use disorder, and the documentation really reflected well the kind of education that they were giving individuals, so that they could decide on the type and if they actually wanted to pursue those medications. They were very clear. They were very detailed. It was really good to see that they took a lot of time to create those documents. And then lastly on this slide, the individual progress notes, they really showed the clinical expertise of the clinicians, the therapists that were working there. They were very detailed. They were very specific. They did reflect progress on the treatment plans. They included, important assignments and work that the individuals did, on their own. That really important therapeutic work that we, all know about, and documented interventions when those were needed really well between, the therapist and all of the counseling staff and the individuals. It really, you can't put this really into the documentation, but it really showed a certain level of investment by the staff working at the providers, that they really, they were really strong clinicians, and that they really were invested in the work that they were doing. All right, next slide, please. All right, and just a few more items. Case management was definitely a part of treatment for individuals that were in 3.5. The records included good documentation of the work that was being done to assist the member into moving into that next level of care with aftercare appointments and options. And then while they were in the program, good in-depth coordination with entities that needed to be involved, such as probation, children and youth, other behavioral health providers, PCPs, whatever that may be. That was definitely something that was good to see. There was a lot of collaboration that way. And then the implementation of daily living skills tracks for persons in recovery. And that was something that Renee talked about, all the different options that they had available for groups to have an individual have a real holistic experience while in treatment. And that is, I believe those are all the slides for the record review. Oh, no, there's another one that got, all right, sorry. And then, okay, so then lastly, a couple more things. The treatment plans were updated frequently. They, excuse me, they were updated timely, and they reflected progress. Physicals as well were completed in a timely manner. And again, as I said in the previous slide, aftercare planning was clear, and it really reflected the options that the members had for next steps.
Okay.
Thank you, everyone.
Yes, thank you, Jesse. Greatly appreciate the information you provided. As you can see, there were plenty of strengths during, our pilot reviews. It's again, just wanted to kind of focus everyone. There was these two main pieces that we had. The first piece was the infrastructure review, which was a review of the documentation to see, just kind of set that groundwork for the work that would be done with ASAM. And then our second main piece was the policy review. Is the record review. And the record review could really kind of just bridges that what's written in the policies is really being carried out with the actual work that's being done with the client. And that was seen in our record review. So next up, our next couple of presenters will take a look at some of the overall areas for improvement that were noted. These areas for improvement are very general. So it's kind of one of those things that it's really kind of taken across the board on all of the pilots. When you're thinking about the information that's coming up in the next slides, think about your policies and procedures that you have in place or what you're documenting in your record review. And maybe hopefully some of these suggestions can really help the next time you take a look at those items. So Anita Kelly will now be presenting areas of improvement for the infrastructure review. Okay, Anita.
All right, thank you, Erica, and hi everyone. Before I jump into this, I just want to say and just give a shout out to um, the providers who were involved in this process, the SCAs, the other BIMCOs, DDAP and OMSAS, who really everyone worked to help the contractor, Mercer, to get this ACM alignment review tool right. And it's really been a truly collaborative effort. And it was just really nice to be part of. So thanks again to everyone. Um, and the areas for improvement that are related to the infrastructure we don't have that many actually, which is great. But we did see evidence of the PCPC still being mentioned in some policies and procedures, and also a reference to fixed lengths of stay, which we know, ASAM does not talk about any type of length of stay. It's all client driven and not program driven. And there should be no mention of short term or long term, especially when it comes to 3.5s, because we no longer have that in place. Um, and it appears that updates to the biopsychosocial assessments only occur if a readmission is occurring within that same program. Um, so this, according to ASAM, the assessment should be updated throughout treatment. If an issue comes up or a change is made, the clinician should go back to the biopsychosocial assessment, make that update, make that change, so that as you're moving forward, the treatment plan is actually really reflecting what is true and what is happening based on that biopsychosocial social assessment as it change as the client progresses through treatment. And then what we noted was that there were several policies that actually conflicted with the program practices. And so maybe a provider is actually currently practicing in the realm of ASAM, but it's just not reflected in the policy. The policies just weren't really updated. And you want to ensure that that's happening. Thank you. Sorry for the mute. One other area of notation for improvement was that we didn't always see that clinical staff were available 24 hours a day. So this should be reflected in schedules, in policies, and so you really want to make sure that that is evident. That's so important. And one of the other areas that really wasn't clear was although there were planned activities and the schedules were clearly outlined, we could not determine which activities were clinical and which were non-clinical. And so, as you know, all the activities have to tie back to the biopsychosocial assessment needs or the treatment plan. Um, and even though there were programs offered multiple groups simultaneously, it was not always evident why the client was attending that particular group. So that is something that really needs to be more clearly stated and outlined in the treatment plan and in the biopsychosocial assessment. Thank you all.
Okay, Anita, thank you for that informative feedback. Now our next presenter will be Rebecca Knoll, who will present areas of improvement regarding the record review. Rebecca, if you are speaking, you are on mute.
Is that any better?
We can hear you now, Rebecca. Thank you.
Yeah, sure. But now I have a horrible echo. Does anyone else hear that horrible echo?
You sound really far away. Is there a way you can get closer to your microphone?
I'm not sure. Is that any better?
It was initially a little bit better right there at the beginning. Yep.
All right, so I'm going to try to talk while also hearing myself echoing my ears. So I apologize if I stumble on anything. And if you can't hear me, please let me know.
You're kind of fading in and out.
Fading in and out. All right, I'm going to try to switch to my other phone.
Okay.
Is that any better?
Keep talking.
Okay, we'll see if this is better. So I'm going to be reviewing the areas for improvement for the actual record reviews.
Rebecca,
Is
you're
this
really
better?
hard to hear.
Oh no, I'm not sure what else to do. Um,
You sound really good in the beginning, like you sound really loud and clear, and then as you continue to talk, you fade away.
yes, I'm not sure how else to join. I had to join my phone because I don't have a microphone available on my computer.
Rebecca, do you want one of us to jump in and do this?
That would be, yes, that would be wonderful. Thank you so much, Anita.
Yeah, sure, no problem. So in the record review went really well. And some of the areas that we noted for improvement were, as I said before, lack of individualization with the programming. So you want to tie the groups, life skills trainings, any educational programming that you're doing, that needs to be tied back to the biopsychosocial assessment. It needs to be mentioned in the treatment plans, and it needs to be then reflected within the group notes or the individual notes. And I'm going to go back to what Kathleen Hoagland has always said, that you need to really consider that golden thread, and it needs to be evident throughout all programming and documentation. So the group topics, as I said before, need to be really relevant to that particular client, and you need to really document why that client is attending that group on that particular topic. How is that reflected back to the treatment plan and the biopsychosocial? And you should be using evidence-based practices and documenting that you're using evidence-based practices. Next slide, thank you. Um, Family programming should be offered, and when it is offered, it needs to be documented that it's offered and who participated, who did not participate, what the barriers were. Regardless of whether the family participated or not, it should be addressed and it should be documented that it was addressed. One of the things that we noted um, was that it wasn't always addressed, and it was kind of overlooked if there wasn't any kind of family participation. Um, Treatment plans should be updated on the regular, and the updates should be reflected in the charts. Um, and Case consultations should occur early in treatment, and or they did occur earlier in treatment, and you may want to consider adding them closer to discharge so that you can actually discuss uh, a more rich discharge plan for the member. Next slide, please. Another thing that we noted was that all activities that clients were involved in were not recorded in the record. Case management services in particular were not documented. Although when we talked with the provider, we noted that they were doing excellent case management services. They just weren't documenting them, nor did they have policy reflecting that. So all those services need to be documented in the client's chart. Um, and when there is a significant psychiatric concern, when there's a trauma noted in the biopsychosocial, referrals should be made for treatment, and those referrals should be documented. If there are barriers to obtaining any kind of specialized services that the client needs, this should also be noted in the record, that, services were attempted, services were not available, and in lieu of those services, this is what is being provided, or this is what is occurring. Um,
One more, Anita.
all right, thank you. um, so the behavioral health technician documentation was not always present in the medical record. Um, we noted that they were, per policy, really providing services, and they play an important role. So they should really be documenting what they're doing, what role they play. Um, the stages of change were not updated throughout the treatment process. So, if a client came in and they were in an earlier stage of change, you know, um, they might be progressing through the stages of change, and that really needs to be updated as they progress in treatment. Um, the clients who are transferring from one level of care to another should be documented within the record as well. All of that should be noted, and the biopsychosocial and the history and physical should be updated accordingly. And one other area of concern was that the clinical time on weekends was not always consistent. It seemed to be either maybe one day or another, but not both days, or really not provided uh, consistently weekend after weekend. So that was one area of concern that really needs to be given more attention. Thank you.
Right. Thank you very much, Rebecca and Anita, for going through that. We greatly appreciate it. So as you can see, there is quite a bit of information in those two areas, our strengths and areas of improvement. So the presentation was really broken down into the areas of the infrastructure review and the record review, and that really mimicked our alignment review process. Again, just please keep in mind, the comments here were just some overall commonalities that we've seen when we were doing our pilot reviews across several sites. Again, just want to strongly place that emphasis on as you are looking at your policies, procedures, your documentation, looking at information that's available in the record review, in the client files, just making sure that process is really clear. It aligns up with that golden thread that Anita reminded us of, and that's really telling kind of that whole picture of what services the clients are receiving. So the next steps, where do we go from here? We completed, the pilot reviews and the pilot review process. Where do we go from here? So there's actually, a couple of things that are occurring, right now, and as we look to move forward. The pilots will receive a summary of the ASAM alignment review outlining the strengths and the areas for improvement. So each one of the pilot sites will receive that. DDAP and DHS, along with the MCOs and SCA representatives, are currently looking at making changes to improve the ASAM alignment review tool. So we had a tool that we developed early on. We wanted to test out that tool. We tested out during the pilots, and we found that there's some areas that we can really make some improvement on before we do a larger scale dissemination of that. So that work has currently been happening, and we're taking a look to see how we can make those improvements so that it makes sense to others who want to use the tool, and to make sure that the questions that we have specifically laid out in the tool is actually able to take a look at, to make sure you're able to measure and evaluate the services that would be occurring as a part of the ASAM alignment. Additionally, what we're looking at is we're going to be looking at some additional residential programs that will be reviewed by a team from the MCOs and SCAs once that tool is finalized. So we're working very diligently to get that tool out to everyone so that we're able to do some additional levels of care at the residential level. We don't necessarily have a definitive date on that yet, but please stay tuned. We are working to get that out as soon as possible. And DHS and DDAP will continue to meet on a regular basis to discuss Pennsylvania's progress with the ASAM alignment as it relates to the adherence to the 1115 waiver. So talks have been continuing. We've been working on this process for a relatively long time. As you saw in Benny's presentation, I believe we even started before 2018, but that's how long that we've been trying to work through this. So as we develop more about the alignment process as well as ASAM, we will, of course, continue to keep everyone well informed. I'd just like to thank a huge thanks to the managed care organizations and DHS for collaborating on this monthly TA call. We certainly could not have done it without you. We appreciate all your time and efforts with this project. It is a very huge project, and we appreciate all the help that you've given us. The SCA staff who has been involved has been extremely helpful in providing feedback and guidance and participating in the ASAM reviews. This is really a statewide effort, all of us involved in this very integral process of looking at alignment and making sure that, individuals are receiving, person-centered individualized care. So again, I would just like to express a heartfelt thank you for everyone. We do have a few reminders before we leave. What we're looking at is our next ASAM TA call. We're going to take a little bit of a holiday break. We're going to take December and January off. So we will be back on Monday, February 6th from 10 to 11. The topic is not yet determined. Please feel free to list or send us an email to our resource account that for any topics, for suggestions. Also, again, strongly emphasize if you have questions about ASAM, please feel free to email that resource account. In addition, this slide will be posted on the DDAP website within the next upcoming days or week or so. So please stay tuned. And if anyone may have missed this, you'll be able to direct them to our DDAP website to look at the slide deck and the presentation. At this time, we are going to conclude our presentation today. Again, thank you, and thank you everyone for being on the call, and we look forward to our continued collaboration with you. Have a great day, everyone.